The slap superior labrum anteroposterior lesion specifically affects the tendon of the labrum of the shoulder. This complex structure crucial of the shoulder mobility and stability can be damaged essentially in the sport involving intense movement. The classification of slap range for minor alteration, stage 1, of complete rupture of the biceps tendon, stage 4. Age is a risk factor due to natural wear and tear, but a slap injury typically results from a significant trauma, such as a fall or violent throwing motion in sport like a volleyball, a handball, or a baseball. Symptoms including pain, a popping sensation, and loss of strength may impact athletic performance, but are often stumble and challenging to detect. In case of uncertainty, consulting a specialist is recommended for appropriate treatment and to prevent any worsening of a slap injury.
Hi, how are you?
Fine, and you?
Fine. Okay. Can you sit here, please?
Yeah.
So, hello, what is your name, please?
My name is Maria Gomez.
Okay, I'm going to ask you some questions to get you know better and understand your pain. How old are you? And tell me about your job and any activities, sports you practice.
I'm 13 years old and I work as a nurse in an hospital. I play handball twice a week, one training session on a week and one match on the weekend.
Okay, regarding your medical history, have you had any surgery? Do you have an allergy or medical treatment maybe?
No surgery, no allergy, but I'm medication for diabetes.
Okay, let's talk about your pain and describe it, please.
For the past 2 months, I have pain in my right shoulder. Initially, I wasn't know it's significant, but for the last 3 weeks, it can sometimes wake up at the night. I'm in a bad position.
Have you had any medical examination? Or can you show me the movement that caused your pain?
When I want to grab something, I hop or I raise my arm to grab an object on the right, it causes a pinch in my shoulder.
Okay, can you rate your pain on a scale of 0 at 10?
7, I think.
Okay, we'll be now move on the physical analysis. Good? Okay, after take off your t-shirt, you can take your back to me, please. Okay, so I'm going to wear the height of the shoulder, and I look the right shoulder is lower than the other shoulder, and but it's not visible deviation of the truck. And the musculature, it's predominant of the left side, but you are right-handed or left-handed?
Right-handed.
Okay. But for the handball, you use the right hand or left hand?
Left hand.
Okay, that's explaining the predominant musculature on the left side than the right side. But now, stand up facing me, please. Okay. I look the right shoulder. It's a little bit forward than the other shoulder. Okay, but now I'm going to palp the important structure of this pathology, like the humeral head, rotator cuff, scapula, or coracoid process, but I value the both sides. Okay. Okay, but here, do you have pain? A little. And here, nothing. Okay. Do you have pain?
No.
Okay. Do you have pain here?
Little.
Okay. Do you feel pain here? No. And here? Little. Yeah. Okay. Okay, now I take all the range of motion of your shoulder, and I will compare the two sides. Okay, for first I make a measure of the flexion shoulder flexion, sorry. Okay, take your flexion shoulder. Okay, approximately 100 degrees. Okay, and I'm going to measure the other shoulder. Okay, go. Flexion. Yes, okay. 180 approximately. Okay, and an extension, go. Okay. Approximately 30 degrees, and you have a limitation of extension shoulder. Okay, do an extension. Okay, good. Okay, approximately 50. Bien. Oh. Okay, do an abduction, please. Okay, 100. Okay, now do an abduction for the unaffected shoulder. Okay, good. 180. Good. Very good. Okay, now do an adduction. We don't. No. Okay. Like 30. No. 20. Okay. And 50 degrees. Okay, do an external rotation, yes. Good. Okay, 80, so approximately normal. And okay, the same. Good. And the same, good. Okay, do an internal rotation. Okay. 45. So, okay, go. Okay, approximately 70. Good. Okay, I'm going to do a passive compression test. I make an abduction of 30 degrees, flexion elbow 90 degrees, a little bit external rotation, and I make a compression of humerus against the labrum. In the same time, I make an extension for arm. Do you have pain?
Yes.
Okay, the test is positive. Okay, now I'm going to do the O'Brien test. For this, you make flexion at 90 degrees and a little bit of adduction and internal rotation. Okay, good. I press in your arm. Okay, do you have pain? Okay, relax. And you make the same test. Good, but in external rotation. Okay, good. And approach. How are you?
I'm good.
Okay, good. Okay, I make the compression rotation test. For this, I make your arm in 90 degrees for shoulder and elbow. And I make a pressure of the humerus against the labrum, and I make a rotation internal and external. Do you have pain? Okay, good. The test is positive. Okay, there is one last test, but it's not possible to perform it because do you not have enough shoulder flexion? Okay, so I think you have a slap lesion because all the tests are positive, and the slap lesion affects the tendon on the labrum, which is part of the shoulder joint.